Millions of people undergo hair transplant operations each year, and most of them achieve life-changing results. The procedure certainly does wonders in the recipient area, but what happens to our donor zone? Are there any scars left after the recovery process? And will you still have hair growth in that region? All of this and more in today's video. Hi, I'm Janos from HairPalace Hair Clinic, and as a patient coordinator I have accompanied the treatment of more than 1,500 patients in the past 5 years. Today we will talk about the recovery of the donor area after a hair transplant. The donor area is typically located at the back of the scalp and is where the hair follicles are taken from to be transplanted to the balding or thinning areas. The recovery process typically takes several months and is dependent on the particular technique used for the hair transplant. There is an important distinction between these two methods, follicular unit extraction or FUE and follicular unit transplantation or FUT. When it comes to FUT surgery, the surgeon will remove a strip of skin from the back of your head. This strip is then used to harvest healthy hair follicles, which are then moved to the affected areas. While this type of surgery is excellent for covering larger bald spots, it comes with one major downside. The procedure leaves a large permanent scar across the donor area where the strip is taken from. This can limit your future hairstyling options quite significantly, as the scar will become obvious to anyone whenever you wear your hair short. Lastly, due to the scarring, you will also lose the ability to grow any hair on the scar itself and in the surrounding area. When it comes to the recovery of the donor area after FUT surgery, the invasive nature of this surgery means that you will need a longer time to heal. The area where the strip was extracted will obviously get stitched together after the extraction process is over. FUT procedures generally take around 4 to 6 hours to finish. These stitches will stay there for around 2 weeks, at which point you will need to return to the clinic to get them removed. You will also need to take at least 1 week off from work to allow your wound to heal up and close up properly. It's also important to ensure that your wound doesn't come in contact with hand dirt, and you shouldn't rub or scratch the implanted area either. Doing so can significantly raise the chance of infection, which can cause serious health consequences and possibly ruin your final results as well. Despite all the downsides of FUT surgery, it certainly provides lasting results, and it also offers a high success rate. The ability to cover massive areas affected by the hair loss makes it a viable solution for those suffering from extensive baldness. Additionally, FUT can cover these larger areas in just one single session, which can often make the hair restoration process less of a hassle. To sum things up, it is an effective, long-lasting solution to hair loss and baldness. But when it comes to preserving the donor area and quick recovery, it is far from the best option. This takes us to the second method used for transplanting hair, which is FUE. FUE stands for follicular unit extraction. This method takes individual hair follicles one by one, which is then implanted into the areas affected by the hair loss. FUE is the most popular method preferred by both surgeons and patients alike, as it offers several advantages over the strip method that we've just covered. First of all, as the surgeon extracts the hair follicles one by one, there is no linear scar left at the end. Now you may ask, surely there is some scarring? I mean, it's a surgical procedure after all, there has to be scarring. Why yes, but also no. You see, the surgery does cause scarring, but these scars are so minuscule in size that they are virtually undetectable after the recovery period. Following the surgery, the donor area will be bandaged up. This bandage has to be removed before you go to bed on the first night. You shouldn't worry about damaging your donor site while you're asleep, as this risk is almost negligible. Although you shouldn't scratch or touch the donor site in the first few days of the recovery. You may feel tenderness or slight discomfort in the area, but this is completely normal. This minor pain tends to go away after 1 or 2 days. It's also normal to have a little numbness for a couple of hours, or even the whole day. This will gradually fade away with the anesthetic too. As the donor area starts to heal, you will notice some scabbing at the affected area. You mustn't touch or pick at these scabs until week 2. At this point, you have to soak your scalp in lukewarm water to soften the scabs and then gently massage your head. Make sure you do this as gently as possibly can. The donor area may show signs of redness throughout the first 3 weeks, but this will become less noticeable once your hair begins to grow out. Once you reach the 3-month mark, the donor area will look completely normal. As the hair slowly grows back in the donor region, the site of extraction will most likely be fully covered by new hair growth. The extraction is done in a zigzag pattern, which means that unlike FUT, your hairstyle choices won't be limited following the surgery. This form of extraction leaves hair follicles around the extracted grafts, which can then grow over these tiny scars and completely cover them up, even with shorter hair. Extracting hairs in such a manner also allows for multiple surgeries. Although your overall density will dwindle in the donor area, the remaining hair will still be able to provide with natural-looking coverage. FUE surgery doesn't require any stitches, as the microscars can close up and heal on their own. You can typically expect to recover from the trauma caused by the surgery in around a week or a week and a half. Taking hairs in a zigzag pattern also allows for better preservation of your donor area, which means you can undergo additional surgeries in case your hair loss progresses. Now, while FUE is an amazing technique that delivers life-changing results, it does have some downsides. The procedure itself takes longer than FUT, as the surgeon needs to extract the hairs one by one. This typically means anywhere from 6 to 10 hours. Furthermore, FUE only allows for the safe extraction of around 5,000 hairs or 2,500 grafts. Any more than that could jeopardize the health of your donor site and ruin the chance of future surgeries. Lastly, FUE may result in bleeding during the first 2 to 3 days of the recovery. While this usually goes away quickly, it can certainly create discomfort. However, it is possible to have 2, 3, or even 4 surgeries with this method, provided you have a dense enough donor site. The minimally invasive nature of FUE also means that there is a much higher chance of a successful surgery, as there's a lower risk of scarring or infection both during and after the surgery. Plus, you won't need to take any time off for the recovery, as you can return to work the next day. No matter which type of surgery you choose, you must ensure that the donor area is kept clean and free of infection to achieve ideal results. Your clinic will most likely provide you with a special solution which you must apply during the first week of the recovery. At HairPalace, we provide our patients with a saline spray that ensures that their scalp stays sterile and clean. Additionally, you should avoid any activities that may cause irritation or trauma to the donor area, such as brushing or combing the hair or using any sorts of styling products. During the recovery period, you may experience some redness, swelling and itchiness. This is normal and should subside within a few weeks. If any of these symptoms persist, you should contact your doctor for further evaluation. Additionally, you should avoid sun exposure, as this can further irritate the donor area and delay the healing. In general, the recovery time for the donor area is dependent on your individual healing process, as well as the particular procedure used. However, with proper care and attention, and by following simpler guidelines laid out by your clinic, the donor area should heal within several weeks. At HairPalace, we only work with the latest FUE method that causes no visible scarring and offers significantly faster recovery times than the FUT method. Thus, choosing our clinic offers the dual benefit of seamless results and lightning-fast recovery. Hair transplantation can offer life-changing results that will completely revolutionize the way you look and feel. So which method would you prefer? FUE or FUT? Let us know in the comments below. And if you enjoyed this video, subscribe to our channel. We post new videos every week, so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thank you for watching.